Welcome back, everyone. For this lecture, we're going to continue down the HEENT series with talking about common eye and ear disorders. Contact lenses can occasionally be the source of a complaint for a patient. The only indication that we have in EMS for removing contact lenses is the treatment of chemical burns to the eye. Otherwise, they'll be left in place, but you may have some encounters with patients that have complaints or injuries to the eye and may need to be removed. There are three types of contact lenses. You have hard, rigid, which are gas permeable, and then soft, which are hydrophilic. Conjunctivitis is when the conjunctiva of the eye becomes inflamed or red. It often starts in one eye, but then can spread to the other eye, and is typically caused by bacteria, viruses, allergens, or even potentially foreign bodies. Assessment and management for conjunctivitis is just to perform a general assessment of vision. While with viral conjunctivitis, it typically revolves on its own. Bacterial conjunctivitis typically requires a topical antibiotic to be administered through eye drops. Severe allergic conjunctivitis may need NSAIDs, antihistamines, and topical steroid eye drops. Inflammation of the eyelid, or chalazion depending on the pronunciation, is a swollen bump or pustule on the external eyelid, while a stye is a red tender lump within the eyelid or the eyelid margin. Assessment and management of these is a thorough assessment of vital signs and history. They are a source of discomfort for patients, but not really a significant life-threatening emergency. You may need to provide supportive care, and a warm, moist compress may help relieve some of the pain. Glaucoma is a group of conditions that lead to increased intraocular pressure. You have open-angle glaucoma, normal tension glaucoma, narrow-angle glaucoma, and secondary glaucoma. It's usually treated with eye drops that help reduce the ocular pressure within the eye. Make sure that you rule out any trauma or physical injury. Perform a general eye assessment, and then an ophthalmologist at the hospital or in the continuum of care will perform a more comprehensive assessment and establish a chronic treatment for glaucoma. Central retinal artery occlusion. This is where the blood supply of the retina becomes blocked. A central retinal artery occlusion can cause temporary or permanent blind loss, and a rapid loss of vision is a significant emergency and does require immediate transport to a definitive care facility. Iritis is the inflammation of the iris. It can be caused by irritants or trauma. And then underlying chronic diseases can also cause iritis, and that can be things like autoimmune disease or things like arthritis and irritable bowel and Crohn's disease as well. The red area around the iris is common along with cloudy vision or an unusually shaped pupil. For this, make sure that you focus on the history. They may respond or have been prescribed topical corticosteroids, and chronic iritis should be referred to a specialist. Papilledema is swelling or inflammation of the optic nerve. This can lead to headaches, nausea, temporary vision loss or narrowing vision fields, and graying in the field of vision. It can be caused by things like abscesses, tumors, meningitis, fever, chronic high blood pressure. It can be another symptom of Guillain-Barré syndrome. And it can lead from things like dental infections, lung infections, and inner ear infections. Prehospital management for the EMS provider consists of treating symptoms and transporting to a definitive facility. Make sure that you're assessing ABCs and life threats, as you should be with all patients. And topical analgesics may need to be administered, or a mild sedative may need to be administered for advanced level providers if the presentation isn't of acute nature. Cellulitis of the orbit. You've got periorbital cellulitis and orbital cellulitis. Periorbital cellulitis is a painful red swollen eyelid. Risk factors can include things like trauma or insect bites. Orbital cellulitis is a medical emergency and does require transport to a definitive care facility. Risk factors can include things like tooth infections, ear infections, trauma, or sinus infections. Assessment and management for orbital cellulitis includes antibiotics, and prehospital treatment will be focused around ruling out life threats, obtaining a history, and transporting to the appropriate care site. Corneal abrasion is a common complaint for the eye that we see in the pre-hospital realm. It is the most common eye injury, and it's caused by direct trauma, typically due to foreign bodies, but can also be from contact lenses or exposure to ultraviolet radiation. Ulcer can develop without prompt treatment, and it can cause blindness if left untreated. The general presentation includes pain, redness, tearing, feeling of something in the eye. It feels, they may describe it as if like I've got sand in my eye or something there that hurts. Blurred vision, loss of vision, photophobia or light sensitivity, and headache. For treatment for this, you're going to again rule out life threats and provide supportive care. They will need transport to a facility as additional care may be needed and assessment to ensure there's no long-term damage that's occurring. For the ears, you've got the outer ear, just a diagram of the outer, middle, and inner ear here. It's the primary structure for hearing and balance, and so ear injuries or ear complaints can often create things like vertigo in the patient, which can lead to nausea and vomiting and other complicating factors. An impacted cerumen is when the ear canal is impacted. Typically, it's a yellowish, oily substance. Earwax is a common production. It's a normal product of the body and serves a purpose. But if it becomes impacted, they may have a sense of fullness in the ear, and it can create some discomfort for the patient. Risk factors for an impact include abnormal ear canal shape, diseases that cause any increase in secretion from the ear, or improper use of cotton swabs. Labyrinthitis is a feeling of vertigo or loss of balance after an ear infection, and it can affect the nerves from irritation and swelling. Symptoms can include things like a ringing in the ears, loss of hearing, vomiting, and abnormal balance or difficulty walking. Pre-hospital care is directed at reducing or treating the nausea and vomiting and transporting the patient in a position of comfort. Serious disorders will need to be ruled out by either a CAT scan or an MRI. Meniere's disease is a chronic condition that's characterized by dizziness, described as a spinning sort of vertigo feeling, low frequency hearing loss, tinnitus, or ringing in the ears, and a feeling of fullness in the affected ear. It's an overproduction and defective absorption of the endolymphatic fluid within the ear. Assessment and management is, again, looking at potentially treating with antiemetics or anti-nausea medications. Any disease with the middle ear is going to impact their sense of balance, and that can create secondary symptoms of nausea and vomiting. And then physicians may treat with diuretics and antiemetics to help reduce the amount of fluid within the ear. Otis externa and otis media. This is an infection of the outer ear and an infection of the middle ear, and it typically results from bacterial growth. It's more common in children than adults, and again, the pre-hospital management for this disease state is going to be supportive care, and making sure that if there are unbearable symptoms, again, so nausea, vomiting, headaches associated, that we treat those symptoms accordingly while the patient is awaiting more definitive care at a receiving facility.